I'm going to be breaking down case study 4 here. Alright, go ahead and get started. Age 38, history of present illness, currently admitted to your floor for 23-hour observation after a single motor vehicle collision in which the patient was unbelted and hit the steering wheel at moderate speed. There are several fractured ribs on the patient's right side, but no other injuries were noted. Upon admission, the charge nurse helps you settle the patient and takes care of your orders while you retrieve requested pain medication for your patient. After administration, you return to reassess the patient 45 minutes after administering a pain medication per protocol and note him to be extremely disoriented. After quickly scanning the room and admission orders, you note that the hanging IV fluids and rate are incorrect. 0.5 normal saline at 500 cc's an hour. Past medical history is occasional lower back pain controlled with over-the-counter NSAIDs and tension headaches. Looking at the medications here, pantoprazolone, 20 milligrams, 4 times a day. I believe that's a proton pump inhibitor. The normal 0.5 half normal saline at 500 cc's per hour in the left AC peripheral IV. Percocet pain medication, 1 to 2 tablets every 6 hours for pain. Alright, gonna go ahead and just break down some of these questions here. Next action. At this point, obviously the patient's disoriented, but I'm quite worried about just his respiratory status. He's got the rib fracture, which, that could affect your breathing. And then, we gave him the pain medication too, which I don't think that's, that's a standard pain medication order, but we note that he's disoriented, so yeah, let's go ahead and do quick respiratory status. I want to know his O2 saturations. What's his respiratory rate? Is he air exchange? Just is he breathing well? What is that looking like? I would really want to know. Also, I guess I'm kind of answering the second question. So yeah, assess respiratory status. I want to know too. I know he's disoriented, but how? What was that baseline? And is the ANO times 3 times 4? What was he and what is he now? That would always be a good thing to figure out. And what else would I do? Action would I take? Well, we noticed that that IV solution was incorrect. So yeah, I'd go ahead and we'd stop that infusion. And I would, in this scenario, I would be wanting to get some normal saline, which is kind of some 0.9%. So I'd probably try to get an order for that. I'm guessing we probably already have one, but it's just somehow this wrong. Half normal saline got hung up, or someone hung that. So yeah, let's go ahead and get some normal saline going on this guy, because just I'm thinking isotonic here. I don't see the need for hypertonic, or in this hypotonic is probably actually hurting him more than anything. All right. What are your thoughts on what is happening? Well, I'm a little bit torn between. I'm thinking that possibly just giving the wrong fluids is causing this disorientation. And I'm thinking that maybe because I don't think that the pain medication would cause this much disorientation. Um, so I'm kind of thinking that's what's going on. Yeah, didn't sound that great. All right. What do you think got the patient to this point? Again, I think I mean, he's got the fractured ribs. Yeah, I think hanging the wrong fluids is putting him in a worse spot than he was before. Are there any lab or diagnostic tests? I'd want to put this guy in O2, probably 2 liters nasal cannula. I would think probably be good. So I forgot to say that. Any labs? Well, yeah, you know what? I would diagnostic test. It would be nice to see a chest X-ray. Just to figure out more on the rib stuff. If it's worse than we thought. Any labs? I do want to do a CBC with differential. I want to know this guy's hemoglobin, platelets, all that good stuff. And I think any other labs. ABGs, what do you respiratory? Well, I don't know, not sure. And then are the medications / fluid appropriate? As again, we already figured out they're not appropriate, and we would want to probably get some isotonic fluids going. Okay.